Welcome to the Dental Podcast. Okay, we've looked through your sources, and today we're doing a deep dive into something pretty central to cosmetic care. The question is, when's the absolute best time to invest in getting that smile you want? You know, a lot of people think there's some magic number, like a perfect age, but what we're seeing here suggests it's, well, less about the year you were born and more about where you are in life.
Exactly. And our goal today really is to quickly pull together this info. We want to look at how cosmetic treatments, things like whitening, veneers, implants, how they fit different age groups, will highlight what works best and when, and crucially, why that timing often leads to the most optimal results based on physiology and maybe even social
Right,
factors.
and we're basing this on sources that detail the services at Dental, but also give a really detailed breakdown of cosmetic procedures by age. So it's not just a list of what they do, it's more like a guide to timing things right.
Yeah, and maybe we should just state the main takeaway right up front for you. Cosmetic dentistry, it definitely boosts self-esteem, confidence, really at any age. That seems clear. But, and this is the key thing, choosing treatments that really line up with your current oral health, where your teeth are in terms of natural wear, that's how you get results that work well and actually last.
Okay, good point. So let's unpack this a bit. We can start by setting the scene, maybe looking at the practice that provided some of this thinking Dental.
Sure. So OmniDental, they're based in Arlington Heights, Illinois. The address is 305E Rand Road, and they serve that whole greater Northwest Chicago suburban area. But what seems really important in the sources is the philosophy. Dr. Billis Poles leads the practice. He's got over a decade of experience, and the focus is very much on personalized attention. Patient first, making sure treatments are collaborative, not just dictated.
And you mentioned they serve Arlington Heights and surrounding areas.
Yeah, places like Buffalo Grove, Palatine, Mount Prospect, Rolling Meadows, Schaumburg, Wheeling, Deep Plains, Elk Grove Village. It's a pretty wide reach.
Okay. And the scope of services they offer, this is where it gets kind of interesting, right? Because it's not just teeth. I mean, obviously they do the full range of dental care, implants, root canals, emergency stuff. But then they blend that with advanced aesthetic services.
Right. That's what's fascinating. It's this holistic view. They offer injectables like Botox and fillers,
Mhm.
skin treatments, hydrofacials, microneedling, even permanent makeup like microblading.
And you have to ask, right, why is a dental practice offering skincare and uh, permanent makeup?
Well, that's what stands out to me too. Is it just convenience, putting it all under one roof? Or is there
Yeah.
something more strategic going on?
Yeah, what's the thinking there?
It seems entirely strategic. Think about a smile makeover. We usually just focus on the teeth themselves,
Mm.
right? But your smile doesn't exist in a vacuum. It's framed by your face. So things like injectables, they can actually adjust how much gum shows or soften lines around the mouth. It ensures that if you get, say, new veneers, the whole look is balanced with the facial aesthetics around it. They're really treating the whole frame, not just the picture inside.
Okay, that makes a lot more sense. So optimizing the whole visual area, not just the teeth dead center.
Precisely. And that lets them create a truly comprehensive plan, one that hits both the dental structure and, the overall facial symmetry.
Got it. Okay, let's dive into the main part then, breaking down these treatments by decade. Let's start young adults, say 20s up to the mid-30s, often pretty image conscious, maybe starting careers. What are their main cosmetic needs?
Yeah, for that 20 to 35 group, the focus tends to be on, well, enhancement and often speed. They usually haven't got much age-related wear yet. Their teeth often have healthy pulp, stable gums. So they're mostly looking for things that give an immediate aesthetic boost, you know, enhancing their appearance for job interviews, social situations. A confident smile is a big asset there.
Right, so quick wins, basically, maximizing how good healthy teeth look.
Yeah.
The sources mention three main options for this age group that fit that quick results idea.
Okay, first one, no surprise, is teeth whitening.
Mhm.
Super simple, not very invasive, and probably the fastest visual impact you can get.
Okay.
Second is Invisalign aligners,
Mhm.
the clear braces. Now, straightening takes time, obviously, but the process itself is discreet. That's huge for this age group. They don't want it interfering with their appearance while it's happening.
Makes sense. And the third one sounds like maybe a bigger step. Porcelain veneers. If teeth are healthy, but maybe, I don't know, shaped weirdly or chipped or a little crooked, veneers give that really dramatic uniform smile. But hang on, veneers usually mean removing some healthy tooth structure, right? Is that really the best thing for someone who's, say, 25?
That's a really important question, and that's where I think modern techniques come in. For younger patients, the goal is always to be as minimally invasive as possible. Dentists might use what they call no prep or ultra-thin veneers. These preserve a lot more of the natural tooth. Plus, there's a physiological advantage here.
Which is?
Well, a young adult's gums are usually healthy and stable, so there's less risk of them receding later on and exposing the edge of the veneer, decades down the line. They're starting with a really solid foundation.
Okay, that explains why it's mostly about enhancement in the 20s and early 30s. But then, as we move past that into middle age, the conversation changes, doesn't it?
It really does. Now we're looking at, say, the 35 to 50 range. This is really the transition zone. In your 20s, cosmetic issues are often elective or maybe genetic. By 35, 40, you start seeing the cumulative effects of, well, just living.
Cumulative effects.
Yeah.
Sounds like just wear and tear, but I guess it's more specific than that.
Oh, much more. Think about decades of just chewing, maybe some night grinding. A lot of people do it and don't even realize. Acidic foods and drinks taking a toll. So we start seeing tiny fractures, chips, maybe more noticeable enamel wear. Teeth can start to look a bit shorter, duller. And this is often when the first serious tooth loss might happen, maybe from an old filling failing or an injury from years ago.
So this group needs kind of enhancement and restoration at the same time. They're trying to fix what time has done, but still want it to look great.
Precisely. Yeah, that's why the sources really emphasize procedures that tackle both function and structure. So, key treatments here. Dental implants to replace any missing teeth. Crowns are big, they cover and protect teeth that are worn down or cracked. And bridges, of course, to fill gaps.
Does the motivation change too? Psychologically, I mean.
Yeah.
Moving maybe from just looking good for a new job to maintaining a professional look, or maybe pushing back against visible signs of aging.
Absolutely. The wear starts to become visible. People might worry about looking tired or older than they feel. So investing in something like a crown or an implant at this stage, it's not just about looks, it's about keeping your bite right, stopping other teeth from shifting around, avoiding more decay that could lead to bigger problems later. It's sort of like preventative maintenance for the long run.
Okay. Then moving into the 40s, 50s, and beyond, the needs sound like they get even more complex, more restorative work needed. What are the main physiological things happening here?
Yeah, the wear really becomes quite pronounced. You see more significant gum recession that can expose the root surfaces, making teeth sensitive. Enamel wear might be pretty severe, sometimes affecting the tooth's inner structure. And missing teeth, much more common, often needing solutions that address the whole system, not just one tooth.
So the goals for this older group are really focused on long-term stability and health, right? What are the main treatments that hit both function and appearance here?
Right. Now we're often talking about the comprehensive smile makeover. And for this age group, that's usually not just slapping on some veneers. It might involve coordinating implants, maybe needing bone grafting first if there's been bone loss, full crowns on back teeth that have taken a beating, and definitely getting gum health sorted out before anything else. These plans can be complex, sometimes taking months of coordinated steps. Function comes first, being able to eat and speak comfortably. Then comes the aesthetic finish.
You mentioned implants specifically, often replacing several missing teeth. The sources talk about things like all-on-4 or full arch replacements. Can you break that down a bit? What does that actually mean for someone listening?
Yeah, good point. That's dental jargon. So all-on-4 or similar full arch concepts, it's basically a technique where you get a whole new set of teeth, like a fixed bridge or denture, but it's permanently attached using just 4 or sometimes 6 strategically placed implants in each jaw. So if someone's losing most or all of their teeth, this gives them a fixed, stable replacement. It feels and works much more like natural teeth. Big difference compared to traditional removable dentures. It restores chewing ability, stabilizes the bite, and massively boosts confidence.
It really sounds like the treatment choice is strongly influenced by these age-related changes, no matter when you decide to actually do something. Why is getting the right treatment early so important for preventing future issues, especially for older adults?
It really comes down to the foundation. When enamel wears down significantly, teeth get brittle, sensitive. When you lose a tooth, something important happens. The jawbone underneath starts to shrink or resorb almost right away. This weakens the support for the teeth next door and can even change your facial structure over time. Choosing the right restoration like an implant, which helps preserve that bone, rather than just a bridge that sits on top, can prevent that whole cascade of problems. It protects your overall health and appearance as you get older.
Okay, let's try and connect this back to the patient experience overall. The sources really highlight modern technology and advancements. If someone's looking at a potentially complex treatment plan, What does today's tech offer that maybe wasn't there, say, 10 years ago?
Oh, the difference is huge. It's transformative, really. And it directly tackles a lot of the fear people have about big dental work. Modern tech makes treatments more effective, sure, but also just fundamentally more comfortable and predictable. We're talking digital planning now. Using 3D scans, computer modeling, dentists can precisely plan implant placement or design crowns before they even start the actual procedure.
So less guesswork, more precision. Is that the idea?
Exactly that. And that precision, plus using advanced materials and techniques that are less invasive, it means less time in the chair during surgery, faster healing afterwards, and significantly lower risks. It takes away a big mental hurdle for people thinking about complex work, knowing the outcome is mapped out and the process itself is just more efficient.
And that loops right back to what the sources said about OmniDental's commitment. They specifically mentioned using advanced tech for better accuracy, efficiency, and patient comfort. When you're potentially combining dental work with some of those aesthetic services we talked about, that kind of precision must be absolutely critical.
It really ties the whole thing together smoothly, whether it's using, cutting-edge ceramic materials for crowns that look incredibly natural, or making sure the microblading perfectly complements a newly restored smile. Technology lets them deliver that complete holistic result without the old trial and error, maybe uncomfortable process.
Okay, that brings us nicely to wrapping this up, sort of synthesizing our deep dive.
Yeah, so to recap the main point for you, it doesn't really matter if you're in your 20s looking for simple enhancements like whitening or maybe veneers, or if you're in your 50s or older needing complex functional work like implants or a full makeover. Cosmetic dentistry today has tailored options for basically every stage of life. The specific treatments change, obviously, but the goal is always the same across the board, getting back optimal function and that feeling of confidence.
So ultimately, the best age isn't really an age at all. It's a personal thing based on your specific needs, what you want to achieve, and just where your teeth are at in terms of wear and tear.
Yeah.
And it really needs that customized advice from a professional like Dr. Poles and his team. Which brings up an interesting final thought for you to maybe chew on. If, as the sources suggest, OmniDental's focus on advanced tech means treatments are more accurate, more efficient, maybe less painful, especially for big jobs like implants or bridges, how might that efficiency change the game for people who are currently dealing with wear or functional problems, but they're putting off treatment? Maybe out of fear or just thinking it'll be too difficult or take too long?
That decision, whether to act now versus waiting until things get really severe, that's often one of the most important choices you can make for your long-term oral health. Definitely something to consider.
Something for you to mull over as you think about your own smile journey. Thanks so much for joining us for this deep dive into the best age for your cosmetic smile.